Alice, and today I will introduce you into the SSRI drug. So, what is SSRI drug? It's a class of drug that typically used to treat the antidepressant and to boost level of serotonin and preventing relapse after an episode of a major depression as well as the anxiety disorder. And researchers have discovered the first antidepressant purely by chance in the 1950s, and they found that the antidepressant was perfect for treatment of the depression. And in 1955, they first tried it, and the patient found that the drug is really helpful by they found themselves like social and more energetic, and the drug was in the market. The first drug that it was in the market is a tofranil in 1958 and was quick followed by a dozen of rival. And why does it call a selective drug? It's because they seem to be primarily affect serotonin only, not the other neurotransmitter. And how does it like the drug? How does the depression link with the serotonin? So serotonin acts as a neurotransmitter, which is a typical of chemical that have relay signal from one area of the brain to another. And there are 6 types of the SSRI drug that have been approved by the Food and Drug Administration, such as Celexa, Lexapro, Prozac, Paxil, Solos, and Vibrate. SSRI seem to be a little bit different from the antidepressants because antidepressant pill that take only about a few weeks to take its action. But for the SSRI, it have to take up to 8 weeks to show it effects that be up in the body. So I have finished my presentation. I will pass it to Lina to talk about Celexa.
Hello guys, my name is Lina and I'll be talking about one of the 2 drugs we'll be talking about today, and one of the drugs I'll talk about is citalopram hydrobromide, which brand name is called Celexa. So the indication will be obviously to treat depression, also to maintain serotonin in the brain as well. The side effects that Celexa can cause will be nausea, vomiting, dry mouth, tiredness, blurred vision, lost appetite, and sweating. The serious side effects will be obviously vomiting, fainting, and irregular and serious heartbeat, which you can have to seek medical attention for that. Overdosing can actually cause trouble breathing and fainting. It can only be given once daily, either in the morning or evening, and it will start off at 20 milligrams first, and it will increase to 40 milligrams depending on the patient. So next in consideration will be monitored heart rate and blood pressure. So why do they take it? So if the consumer experience a major depressive episode, they need to show at least 5 of the 9 symptoms, which are depressed, loss of interest, significant change in weight, either weight gain or weight loss, suicidal attempt or ideation, slow thinking, increased fatigue, psychomotor agitation, feeling guilt, insomnia, and hyposomnia. Facts about these medication is that don't use other drugs such as the NSAIDs or warfarin or aspirin with Celexa, as it can actually cause internal bleeding and bruising. The MAOI can actually cause serious interaction as well. Celexa can also be used for off-label treatment such as panic disorder, alcoholism, and generalized. So next I'll be handing it over to Jana, who will be talking about another medication.
Hello everyone, so I am Jonna and I am here to discuss the next drug, which is fluoxetine Prozac, an antidepressant under the SSRI group. This drug is used to treat depression and other conditions such as bulimia, OCD, panic disorder, and a few others. This drug works by inhibiting serotonin uptake in the synaptic receptors, making serotonin available in the brain for usage. This results to improved mood, sleep, eating habits, and energy levels and may restore interest in daily living. This is usually given once or twice a day, and side effects may include anxiety, insomnia, drowsiness, and asthenia. Nurses, rather, should watch out for these kinds of symptoms. These drugs may also be taken with or without meals. Nurses should remember that this drug should be given in the afternoon as to prevent insomnia from happening. Cardiac markers should also be taken notice as these drugs may create a QT prolongation which is fatal for clients having history of heart problems or for literally any patient taking these drugs. Abruptly stopping the medication is not allowed, so few intervals of tapering the medication lower and lower as to not produce withdrawal symptoms. These medications take 4 to 5 weeks till it actually works, so clients should be patient with the medication as to not actually feeling better that when they just took it recently. And so to conclude everything with the SSRI group, I'm passing it on to Mike for the conclusion.
In conclusion, as a future healthcare provider, one must be vigilant and well versed in assessing the signs and symptoms before any drug administration. For SSRI, antidepressants are rarely fatal in overdose when taken alone. During the 10 years that SSRI antidepressants have been marketed, there have been remarkably a few fatal overdoses reported in the literature or to the AAPCC or FDA involving ingestion only of an SSRI. Moderate overdoses up to 30 times the common daily dose are associated with minor or no symptoms, while ingestions of greater amounts, around 75 times the common daily dose, induces drowsiness, tremor, nausea, and vomiting. At a more serious adverse effects, including seizures, ECG changes, and decreased consciousness may occur. SSRI overdose in combination with alcohol or other drugs are associated with increased toxicity, and almost all fatalities involving SSRI have involved co-ingestion of other substances. Also, in general, research have found out that SSRI are way more effective in treating the side effects for depression.